Good morning and welcome to Backyard and Beyond. This morning, visiting with Marcia Rabe from Cass County Health Systems. And of course, it's time to talk about diabetes again, Marcia.
Yes, it's Diabetes Month in November, and it's an annual event that the American Diabetes Association has to bring awareness about diabetes. The American Diabetes Association started last year a campaign called Stop Diabetes. And the reason they started that campaign is as we have talked about in the past, diabetes, particularly type 2 diabetes, is on the rise. 24 million people with diabetes, 6 million don't know they have it. By 2050, they're saying that 1 out of every 3 people will have diabetes.
So let's stop that.
Yes.
Yeah. I think the scary thing, too, is that younger and younger people. I mean, it used to be you didn't have diabetes, or at least you didn't have it diagnosed till you were older.
Exactly. So type 2 diabetes is occurring at younger and younger ages. Part of the reason, which I read in the statistics, that there is going to be more people with diabetes, the good part of that is that we're living longer. So the longer you live, the more risk for diseases, I guess. But the other part is that people with diabetes are living longer and living healthier. So that part is the good part, that we have ways to help people live healthy and live longer with diabetes than 20 years ago.
And that's probably due both to self-care and doing things that we ought to do, as well as medical treatment.
Exactly. Yes, we know. I mean, there are so many more medicines now to help people gain control of diabetes. And then as healthcare professionals, we know the importance, which we didn't know before, of blood sugar control and blood pressure and cholesterol and all of those things.
So are there some more things you want to tell us about the Stop Diabetes campaign?
Well, the Stop Diabetes campaign it's basically what they're focusing on is sharing about diabetes. People can go online and at stopdiabetes.com, I believe. Yes, stopdiabetes.com, and they can share their stories about diabetes. And it's interesting to go on there and listen to those stories. And they actually have prizes. There's going to be some prizes, so you can go on up until November 30th to share your story, but you can look at stories anytime. And then ACT, and that's all of us kind of getting into the campaign of stopping diabetes. Learning, there's a place to learn on stopdiabetes.com, or you can call 1-800-DIABETES. And then give. Of course, if you can't have any extra resources that you can give to the American Diabetes Association, that helps them in their Stop Diabetes campaign.
Okay. So great source of information. It's credible information. And like you say, stories are probably, people go, oh, I didn't know that's the way it could happen. So those stories, I'm sure,
personal stories are always interesting.
Very interesting. Yeah. And hopefully lead then to finding out more good information. So to go along with this, of course, the hospital always sponsors some special activities.
Exactly. So every November we have some programs to highlight diabetes, and this year we're doing 2 programs. One is Wednesday, November 3rd. It's from 11:30 in the morning till 12:30, and we're focusing on circulation and diabetes. Dr. Walke, who is a vascular surgeon and comes to the outpatient clinic at the hospital, will present a program related to circulation and diabetes. And then Wednesday, November 10th, from 5:30 to 6:30 p.m., we have a program called Taking Control of Diabetes, and it's called an A1C Champion program, and it's a person who has been successful managing diabetes that comes and shares his strategies for self-management and roadblocks and how he's overcome them and things like that. So it's always an interesting story again to hear from someone who has diabetes and has lived with it and can help others who have diabetes with some of the same issues.
A little motivation there to say, well, if he can do it, probably I could do it too.
Exactly.
Yeah.
These programs, there will be a light meal with them. It's kind of a dine and learn kind of thing. And so we do need people to pre-register because of that. And so you can register by calling 712-243-7833.
And if you don't remember that number, just call the hospital, right?
Exactly, yeah. The
you
hospital.
can always find that number.
Yes.
And So I'm sure even the dining is a learning experience.
Yes, well, we'll help people understand the carb part of it and that kind of thing.
Yeah.
And the programs are free, so there's no charge to them.
Okay, but you do need that registration because you want to have enough food and enough
Exactly.
space and so
Yes.
on for everybody.
Yes.
So before we leave, we'll kind of remind people again of those dates. I was wondering, Marcia, when you have the health fairs, et cetera, you go and you can get a test for diabetes, but what does that show you when you just get the regular blood test?
Right. When people go to a health fair and have those lab tests done, then one of the lab tests is called a fasting blood glucose, and that's the test that you look at specifically related to diabetes, whether it's normal or not. So that test, if it's under 100, then that would be considered normal. If it's between 100 and 125, that's considered prediabetes. It's considered that your body's starting to have some problems, keeping that blood sugar in a normal range. So the prediabetes area is an area to take seriously because it can quickly develop into diabetes. Not for everyone, but for some people. And it's also an area that there's increased risk for cardiovascular health. So that's important. Then if it's over 120, 126 or higher, then that's a diagnosis of diabetes.
And let's get something happening.
Yeah.
We need to move on and
Yes.
see a physician. And so then, when a person is diagnosed, I'm sure there are regular testing and so on, blood testing. So what is that? What does that mean? What do they find out?
Yes, when you have diabetes, then part of three important things is to blood sugar control, blood pressure, and cholesterol. So there's a test called an A1C, which is what our program Taking Control of Diabetes, he'll talk about that also. But the A1C is a test that gives us a 3-month history of your blood sugars. And it's hard for people to understand how we can figure that out. But in a very simple explanation, when we draw blood, what they are measuring is the sugar coating on our red blood cells. And our red blood cells live for 2 to 3 months, so it gives us a history of that time. So if we did it on November 1st, it would give us a history over October and September and a little bit of August of your blood sugars. The goal it comes back as a percentage number, and the goal is to try to keep it at 7% or less if you have diabetes, unless there's specific other things going on. But for the general public, 7% or less.
All right. So and it's always good to, because you can get a printout of that it's always good to ask those questions of what does this mean? Because there'll be a whole list. Maybe if it says normal, then something that's high or low.
Right.
Probably good to ask about that.
Exactly. I think it's so important for people with diabetes to be aware of what their A1C is, what their blood pressure is, and what their cholesterol is. Don't just let the healthcare provider take care of those things. It's so important for you to know what they are and what the goals are for them, so that you can help your provider be a team with the provider, so that you're active in taking care of diabetes, because it's really a self-management disease.
Do you recommend that people have the blood pressure machines, cuffs, whatever, at home and do that on a regular basis at home?
I think that's a good idea. The goal for people with diabetes is to have a blood pressure of 130/80 or less. And blood pressure is a silent disease the same way blood sugar is. I mean, nobody really feels if their fasting blood sugar is 126 and not 100. But we know that that's not the safest number, So I think that, like we have people check their blood sugars at home, it is good to have your blood pressure checked, because you can't feel if it's creeping up.
Okay. And again, there's always new things coming out in terms of the checking and so on. And I guess that's one of the things that when you have classes and so on, you let people know what some of those new things are that are happening?
Yeah, one of the main focuses in our diabetes education program that we have is to help people look at risk reduction. And that's just basically, looking at staying healthy with diabetes. What's important? What do you want to look for? How often do you want to have the test done? And then, lifestyle things to help you figure that out also.
Okay, Marcia, quickly give us the dates and times of the programs that are coming up.
Okay, the program coming up Wednesday, November 13th is 11:30 to 12:30. Dr. Walke, a vascular surgeon, will talk about circulation and diabetes. And Wednesday, November 10th from 5:30 to 6:30 is taking control of diabetes. A1C champion Frank Atherton will talk about living with diabetes and share his personal experiences. And you can pre-register at 712-243-7833. The programs are free. And I did want to quickly mention that Cass County Hospital Health System, we're looking at taking care of the person with diabetes, and so we've developed a team to help us improve our care of people with diabetes.
Okay. So if you have questions, suggestions, whatever, call the number Marcia gave you or call the hospital and ask for Marcia and get your questions answered.
Exactly.
Yeah, thank you very much, Marcia Rabe, for being with us this morning.
Thank you.
Until next time, here's a thought. Be too big for worry and too noble for anger.